Hi, I'm Nick Sukic, a managing director and partner at Boston Consulting Group, where I work primarily at the intersection of our healthcare and social impact practices. Over the last 18 months, BCG has been involved in COVID response efforts around the world. We've worked with more than 50 countries, more than 10 US states, and many global health multinational organizations in COVID response and recovery. We've also published thought pieces on the state of the pandemic and on economic impact. I'm here today with a group of esteemed panelists to talk more about coordinated response of private sector players to the COVID crisis. I'm delighted to introduce three esteemed panelists. First, Jill Huntley, who's the Global Managing Director for Corporate Citizenship at Accenture. Also, Mike Carney, Senior Vice President of Emerging Issues at the US Chamber of Commerce Foundation. And also Nisha Biswal, also a Senior Vice President of International Strategy and Global Initiatives at the US Chamber of Commerce. I want to let them do most of the talking today, so let's jump right into the discussion. So the Global Task Force on Pandemic Response sought to drive collective action and impact, but the context of each of the companies that participated in the task force was quite different. Jill, I'd love to start with you by hearing a bit more about Accenture's response to COVID around the world and what you were able to accomplish as members of the task force.
Thanks, Nick. It's great to be here today, and it's such a privilege to be able to reflect on these last few months because they have really been extraordinary. And I think for us at Accenture, the Global Task Force was such an important pillar of our overall COVID response at Accenture. Aside from the scale of impact that the task force allowed us to have in India and later Southeast Asia, it also provided a model and a benchmark of collaboration, which has helped us to make additional impact in many other places around the world. So the task force was the main part of our philanthropic contributions in India, although we also made donations of an additional $10 million to local initiatives in our communities there. And we structured that response in India in three areas. We were augmenting the healthcare and hospital capacity, so that was sort of oxygen and equipment. We were reducing strain on the health system by providing home care to our employees and others in the community. And we were looking to protect lives through vaccinations and related information. And beyond India, we responded to COVID crises in a number of other places where we have employees. And obviously there was great need in many communities. And just to give you a sort of a couple of data points that might help you to frame the sense of where Accenture operates, we have 624,000 employees in over 50 countries around the world. And in India alone, we have 250,000 employees. So that was the sort of scale at which we were looking to engage with our own people and with the communities in which we operate. And so our COVID response needed to address, multiple countries at the same time, all with slightly different needs. And before the crisis in India, our response had followed a fairly sort of familiar set of lines around, through lockdown and recovery. And we were supporting a number of programs that were balancing immediate response with stages of recovery, and then in some cases starting to rebuild. And with the size of the crisis in India, we really had to think differently. There's a different scale and pace of response that was needed, and our approach evolved quite dramatically. And I think helping to sort of mobilize and support the Global Task Force was a really important part of that. We can talk more about how that came about, but ultimately it did anchor our overall response in India and provided a sort of new momentum to that. And then, as I said, it became a bit of a template for collaborating elsewhere. And in the end, we mobilized community responses in India, in the Philippines, South Africa, Brazil, a number of other Latin American countries, and then into Southeast Asia, where again, we were able to work with and through the task force to ramp up our own actions alongside those of the task force. So I think, to summarize all of that, the task force was certainly a significant center of gravity for Accenture's response overall, and particularly in India and Indonesia. And it just really offered a way of thinking about and pursuing our response in other places as well.
Thanks. It's really helpful to hear. I think Accenture, like many other companies, was very active in participation around the world in various COVID efforts, and helpful to hear a bit how the task force created that center of gravity and that sort of coordinating function. Mike, I'd love to turn to you, if you don't mind, sharing some of the experiences you've had from engaging with other private sector actors that were part of the task force as well.
Thanks, Nick. And first I want to say thanks to Jill and to her colleagues at Accenture. One of the big learnings that we have had over the course of the pandemic is just the importance of a strong public-private response to this. And what the engagement of companies has shown us is, I'd say there are really three key learnings. One is that catalytic leadership by global CEOs can really spur action. It can also force other institutions to move faster, which can be really, really important in a life and death situation as posed by COVID. The second thing I would say is, one of the things that differentiates the Global Task Force, and there are many aspects of it that are different from anything at least we've ever done, is the intersectoral collaboration. So, it's great when one company steps forward and does something, but it is impossible to measure the impact when you have companies that leverage their core competencies across multiple dimensions in pursuit of the same objective, which is to save lives. And that was evident in India. It's been evident in Southeast Asia, and we see it, frankly, all over the world as we try and engage in different ways to support the global response to the pandemic. The third thing I would say is, that public-private partnerships have enabled the progress we've made since early 2020, and they will ultimately be what get us through this pandemic. It is that combination of public sector, private sector, NGO expertise, and also commitment that has made a difference, is making a difference today, and will make a difference as we work through what could be the hardest part of the pandemic, which is ensuring that all of the available vaccine doses are converted into vaccinations as quickly as possible, especially in low and medium income countries. So we've learned a lot. I think we've made a lot of progress, and I think that this is the path forward for responses like this.
Excellent. Nisha, anything you would add, reflections on the contributions from other private sector players in the task force and in global COVID response writ large?
Sure. All of this kind of came to a head in the spring of 2021 when India had its COVID crisis, and it was just a crisis of the likes of which we had not seen before in any country, with the massive scale of need that was emerging. And what it showed us was that it is often the private sector that provides the kind of early warning that something is not right, something is not well, and that governments need to pay attention. I would say that the private sector caught on earlier. The US Chamber, through our members in India, through our staff in India, Accenture, hearing from their teams in India, across India, hey, we're seeing the numbers tick up, hey, we're seeing overwhelming of capacity, this is going to grow, this is going to grow. So that early warning that we were able to gain in India is something that we also saw happening in other geographies as the Delta variant kind of made its way around the world. Oftentimes we would hear about the impacts in Southeast Asia or in Central America, in Mexico, before the US government necessarily picked up on it. And that is an important learning, because we do have people around the world who are in the right place at the right time to see what is happening in these communities and to be able to galvanize action. The other thing was that it fostered a new kind of public-private partnership where the private sector wasn't seen necessarily just in terms of mobilizing cash, but actually in mobilizing capacity. And that capacity that the private sector brings, the know-how, the facilities, the technology, that I think has been as important as the resources, the cash resources that have been mobilized. And so, it's how does the private sector do the problem solving? And I think that was a big learning through this COVID experience. And I think we're going to continue to see more opportunity to leverage private sector capabilities in solving public sector problems and challenges.
I couldn't agree more. And you used two of my favorite words there, capacity and capabilities. And I think the private sector really brought both to bear, and would love to dig into more of those as the panel goes on. But first I want to pick up on something Mike said, which was around the catalytic impact of having CEOs involved. And Jill, I know Julie Sweet was really keen to be involved in Accenture's efforts here. I'd love to hear really tactically, what did it take to get that level of engagement from your senior leadership in this COVID response?
Well, you're right, Nick. I mean, the involvement of senior leadership in this task force, it is very striking. And I think it's actually one of the defining, features and a powerful legacy from this crisis. In our case, it came right from the top. And Julie Sweet, as she reviewed the incoming data on COVID cases amongst our own people back in April, and Nisha mentioned the sort of, the private sector sort of insight and data that we had. But, as she looked at that data and she realized what was happening, she also realized that, these employees that were being affected had families, they lived in communities that were also suffering, and there was going to be a sort of knock-on domino effect here. And she just felt that something different was going to be needed to make an impact in that context, and to do so rapidly. So, I mean, her approach was to reach out to other CEOs, and, along with Arvind Krishna at IBM and Brad Smith at Microsoft and others, that, they were able to mobilize this group of CEOs to form this task force. So, each CEO sort of figured out and brought their own part to the equation, their own insights, their own resources and relationships. And I think, that had a sort of knock-on effect back into our business, into our organization. Their visible engagement was obviously meaningful in mobilizing others, but it also sent a really powerful message inside our organization. And it set a really strong precedent for personal engagement of the C-suite. And Julie has gone on record as saying that her involvement in the task force was one of the highlights of her career. And, I think that's partly about the impact that was possible, but also partly because of the personal engagement and what was, what flowed from that. Our chief HR officer was also part of the task force of HR leaders who similarly connected and mobilized, shared their insights, their local status on the ground, their thinking, and sometimes their experimentation, on what could be done to support employees and their families, and knock on sort of benefits to the community. So, new types of benefits, new ways of delivering those benefits, and needing to be able to do that without necessarily having precedents, to do so. So I think, it wasn't difficult to persuade people to contribute. I think the key was, how do we bring the thing that we can offer, the core capability of the business? Where do we need to pull from inside our business to make this possible? How do we bring that together? And I think, having that C-suite action from the front was really key in doing that.
Mike, maybe from where you sit at the Chamber Foundation, any other observations you have and how CEOs and other senior executives were involved from the various companies that participated in the task force?
Yeah, I want to actually answer that by building on what Jill and Nisha have just said, because I think they're very complementary. This began at the CEO level. There were multiple conversations among CEOs who were really, there was just mounting concern about the emergence of the Delta variant and what that meant to the communities where they do business, to their employees, and to the world at large. And what they brought to those conversations, which it was a highlight of my career to even hear those conversations, was not just like, well, can we write a check and can someone else solve it? It really was what Nisha was talking about. How do we take our core capability as CEOs? Then how do we take the capabilities of our companies? And then how do we solve this? And, you know, I've just been really struck by the level of personal commitment from CEOs, but also their teams. You know, there were points early on in the global task force where it felt like we were having a meeting every single day with Julie Sweet and Brad Smith and Arvind Krishna and folks from their teams. And now, you know, as our response has morphed in different ways, we're having similar conversations with different people who have different expertise that's required at this moment in the response. The one consistent thing is it's very rare that we have to ask someone for help. What we're frequently in the position of doing is how do we take all the different things that people want to do and compile them and align them in ways that allow us to maximize the impact. So we're summing the parts to produce a greater impact. And that is one of the most exciting parts of all of this.
That's really helpful. I want to build on that a bit by coming back to this question of capacity versus capabilities that Nisha had hinted at in her initial response. You know, if I think about those two, one of them is really a contribution of time and effort. The other is really a contribution of skills, know-how. Nisha, maybe to you first, if you think about the internal mechanics of how a private entity might participate in response, what did you see as examples of each of those things, the sort of capacity side and then also the broader capabilities side?
So, you know, normally companies are very focused on their core mission, and they've developed some core expertise in advancing that mission. What I saw was a willingness for companies to say, hey, we have these core capabilities, these areas of expertise, and we can reorient them to help address the critical needs and the gaps that we're seeing as we're looking at COVID. And so, for example, you would see a company say, we have facilities in 6 states where we could stand up, for example, health sites that we could help support both our workers, their family members, and their communities for, you know, ways that we can help them to weather this and to take our, you know, assets, our resources, and even sometimes our personnel, and refocus them towards meeting these urgent needs. And then, you know, the ability to perhaps scale that, and the ability to leverage that, I think, speaks to, you know, some of the ways in which kind of the capacity of a Julie Sweet or an Arvind Krishna to leverage a vast infrastructure in a country to help support these kinds of needs. So it was just an extraordinary experience, because it was not the normal silo in which we tend to think about CSR and social impact as things, you know, ways in which we give back to a community. This was actually a little bit even more existential to how do we help tackle this problem that we are all experiencing together, right? And so it was solving for the business, the community, and the larger kind of country all at once. And it's you know, just an extraordinary learning in how these executives were able to take their core business and apply that towards a completely unique and different set of challenges.
That is great. Thank you. I want to come back to Jill on the capacity side of this and how you engage the employees of Accenture. I know from some of our past conversations, you've mentioned that you even seconded people to this effort and really made the most of the capacity that they wanted to bring to bear. How did you do that? How did you engage the workforce generally, the hundreds of thousands of Accenture employees you mentioned, and what specifically did it look like for some of these secondees to participate?
Well, it wasn't difficult to find people who wanted to help for obvious reasons. So it was much more about how were we going to channel, the interest, the energy, the compassion that was, coming from so many places across Accenture. And, at a sort of rather mechanical level, we formed various task forces. We had a task force who liaised with the global task force in these meetings, these regular meetings, and we drew on our employees and our people from, our supply chain business and practice, from communications, from human resources, and so on. So, people participated in that way. We had steering groups and task forces in the local countries, again, pulling on particular expertise that we needed. And we had employees put up their hands to join those, and really trying to find a very agile way of doing that, of bringing employees into the place where their skills could be applied at any one time was something that, at a global level, we spent quite a lot of time trying to figure out. Ultimately, I mean, we had folk from our legal teams, we had folk from our finance teams helping to process funding. We had our procurement leaders looking at how we could bring surge capacity to purchase goods and equipment, where there were barriers or blockages in place through the business as usual processes. And, the last thing we did with our employees, because, many were not in the places where they could actually physically help, was we launched a giving campaign. And, our people are smart, they're informed, and they watch this situation unfolding in their own countries, in other countries. And we mobilized what has become the largest ever global employee giving campaign at Accenture. And I think one of the characteristics of this whole period, whether it's bringing core capabilities or mobilizing the sort of individual action and passion of our people, was really the idea that global is local and local is global. Because those, they merged very much during this period, and the ability to be able to operate across multiple countries and to coordinate and orchestrate in multiple places, but at the same time become very, very local in impact and decision making and so on, was really, really key. And even when it came to our employee giving, to be able to mobilize 624,000 people, but to channel the funds to the local organizations in the local communities and make sure that they reached the place of greatest need. That was an exercise in moving from the global to the local and back again all the time. So we wanted to make sure that the funds being raised were reaching these communities. We worked with our partner Benevity with a giving platform to do that. And ultimately our people raised over $1 million, which Accenture matched to these local organizations. And we did this initially in India, but then replicated the model in other cases. But what we have as a result of that now is a model that we can lift and drop into other situations. So, to answer your question, Nick, around our employees, it was a range of ways in which we pulled them in. And it was really about the agility to kind of do that at the right time in the right place, and to not be constrained by the local and global geographies, but to try and sort of work across all of them at the same time.
That is great. The way you balanced global and local, the way you engaged a global workforce to contribute in many different ways is a great example of what this can look like at a company the size of Accenture. Mike and Nisha, any other best practices come to mind in terms of employee engagement of some of the other task force participants?
I'll let Nisha go because she had a unique vantage point as the president of the US-India Business Council. She has employees in India when we were doing this response who are also helping with the response.
Well, and I think, thanks, Mike. And I think, one, we did have the experience of most of our team in India at some point in the early part of this year actually came down with COVID. So it was something that affected us as much as we were also trying to affect the trajectory of the pandemic and support the response. But what it did tell us was some of the critical needs that emerged, right? And we had firsthand experience, and I think Accenture certainly could speak to this. I mean, part of the CHRO group grew out of our understanding that our teams needed support and their families needed support, and that as hospitals were overwhelmed, the more that we could find ways to support them through, getting essential items to them in their homes through telemedicine and counseling and, essentially mobilizing resources, the more that we were going to be able to have the capacity we needed to help others. And so that became a big learning through our teams, that we needed to, one, practice self-care for our teams, and then two, to be able to activate our teams to be able to then help others and be part of the response.
Thanks, Nisha. We have a little under 10 minutes left, and I'd love to shift focus for our remaining time to forward looking. I think this has been a great retrospective. Mike, I want to come to you first because you hinted at this already in one of your prior responses, but there's still a tremendous need globally to make sure that vaccines become vaccinations. What role do you think the private sector can play in supporting that in other geographies beyond those that have been supported in the task force?
It's a great question, Nick. And I think that the role that the private sector can play is almost limitless. This is my assessment, right, is that we don't have a money problem. The doses are being purchased, at least in the near term. The doses are being delivered. What we are going to run into is a significant distribution, logistical, and administration challenge. And what that's going to require is a new level of commitment from all facets of society. We spend a lot of time talking to companies that want to know, how can I help? And, there are really basic things that you can do. And, as Jill was saying, like making sure that there is funding available to the local organizations that are dealing with these last mile challenges. But there are also macro challenges. One is that this has to remain a priority for developed nations, even as they get their populations, the relative vaccination rates are much higher. Because this is a global threat, and COVID anywhere is COVID everywhere, as the now cliche goes. So companies can do a few things. We've been talking a lot about the global task force in using the past tense, but our work continues. We procured more than $50 million worth of oxygen and other supplies for countries that have had emergency needs. But we've also recognized that that's not a scalable solution. So one of the things that we've been prioritizing is connecting people with support to people who need the support. And some of that, is what seems like really basic things. For example, cold chain logistics is a huge issue in low and medium income countries because they don't have the necessary infrastructure to handle some of the vaccines that require special storage or transportation. So what we've done is we've brought together companies that have developed their own systems, companies that are not logistics companies, but as part of their daily operations have come up with ways to implement a cold storage system, to talk to government officials about ways that you can come up with creative solutions. We're also working with secondees from companies that have stepped up to develop things like a matchmaking tool so that we can identify countries with specific needs and companies that have specific capabilities or capacity that they're prepared to offer in those countries. And then the third thing that companies can do is that they can try and deepen their engagement with ministries of health at the national level or health agencies at the local level to ensure that there is a clear line of communication. One of the most astute observations I heard actually occurred earlier in the pandemic as the US was struggling to get vaccines out the door and into arms. And that was that we had people in the government talking, and they needed specifics from the companies about what they were offering. And then we had people in the companies that wanted to help that needed specifics from the governments in terms of what they needed. But both were really busy and both were speaking different languages. So the more that companies can do to recognize that challenge and overcome it, the better.
Great, thank you for outlining all of that. So last question, and I would love to hear from all three of you on this. Based on the successes that we've seen through this increased level of coordination and collaboration of private sector players in COVID response, how do you envision corporate citizenship will evolve in response to future disasters, health emergencies, and humanitarian crises going forward? And maybe Jill, will start with you.
Sure. Well, at the risk of repeating again, I think just this lesson learned around the application of core capabilities and the collaboration. We've spoken about it, but I think it's worth repeating in terms of looking forward. I think that's just going to be a model that sticks and stays. And hopefully the pandemic is not to be repeated soon, but the interconnectedness and the complexity of our world is likely to demand these sort of more sophisticated responses in future. And in an age of climate change, that's going to be absolutely essential. So I think looking forward, I think it's a change that we need to continue to pursue. And I think this idea of the overlap between employees and the wider community and the connection between the two, I think that's something else that is probably here to stay. Accenture is a people-based organization, so it was especially clear for us, but I think, I know that from speaking with peers in other companies, the same was true. And with the rise of health and well-being as a material issue for many companies, but also, because the boundaries are more blurred between the workplace and home in so many ways, I think that continuing integration is going to need to be part of the thinking about corporate citizenship, about how we engage with communities and about the sorts of contributions we make. I guess just a couple of other thoughts. I think, the very agile way in which this was executed, and I think it was Nisha that mentioned around the sort of evolving governance. I think, again, thinking about how we respond to these situations in very agile ways and evolve the models of engagement, the bringing of these capabilities and capacities over time as things evolve, I think is a very useful lesson to take forward and to apply. And perhaps lastly, and this does bring us back again to collaboration, but the importance of established partnerships and the trust that exists within those partnerships and relationships. So, being able to mobilize quickly, the task force to mobilize quickly was to a large extent because of the trust that existed, at the Business Roundtable and the Chamber, built up relationships over time that could be leveraged, and the insights that can be brought from the local to the global and so on. So I think, we've always, I'm sure all of us have always worked in partnership, but I think the importance of the trust in those partnerships to being able to mobilize and to do things in a different way with these different contexts, I think is critical. So, we were able to achieve more when we collaborate using our unique and complementary capabilities, insights, and resources, and we need to keep doing that.
Absolutely. That trust and the value of collaboration are important. Certainly the agility in response here. You mentioned climate, and what's interesting is, in the context of a very acute health crisis where timely action was really required that agility mattered. I'm really struck by COP26 and the level of corporate participation and commitments. So maybe in our last minute, Mike and Nisha, on climate and other topics that are bigger, longer term, maybe not as acute as a global pandemic, how do you see the role of corporate citizenship evolving?
You know, corporations are increasingly aware that for them to be able to be financially sustainable, they need to exist in communities that are sustainable, socially sustainable, environmentally sustainable, and economically sustainable. And so you are seeing increasingly that companies are deeply invested in ensuring that the communities in which they operate, the communities from which they source, the communities in which that those communities are also thriving communities. And so I think you're seeing a completely different approach to corporate citizenship, which is less philanthropic in nature and more essentially sustainment. You know, that we have to be part of a community and part of helping it to thrive. And that, I think, is the next step and an important evolution in how we think about what it means to be a corporate citizen.
Excellent. And I'm getting the proverbial hook. I think we're out of time. Mike, I apologize I didn't get to your response there, but I want to thank all three of you, Jill, Mike, Nisha, for sharing your insight, your observations, even some of your predictions for the future. I think this has been a really great discussion and greatly appreciate your time.
Thank you.
Thanks,
Thank
Nick.
you.